New Disabled South presents.
We just want the same things that everybody else has, and we want and need medical care, and it shouldn't be something you have to jump through a million different hoops to get. We want to work. We want to be productive members of society.
In Mississippi, where approximately 180,000 people are dually eligible for Medicare and Medicaid, Jennifer has learned that love and work, two things most people take for granted, become privileges she can't afford. At 42, she's been dual eligible for 15 years, managing bipolar disorder with the right combination of medications and a strong support system. She's a stay-at-home mom to a 2-year-old, engaged to a man she calls her husband, but can't legally marry. This is a story about invisible disabilities and visible barriers, about a system that forces impossible choices between love and survival, between contribution and coverage. I'm Stacey Abrams, and this is Dual, the true cost of care.
Dual, the true cost of care. There is no rule book.
Jennifer is 42, a stay-at-home mom to a 2-year-old, living in Mississippi after a lifetime in Florida. She's been dual eligible for about 15 years, navigating bipolar disorder and a system with no instruction manual.
I'm 42 years old, and as I said, I'm a stay-at-home mom to a 2-year-old. I've been dually enrolled probably for the last 15 or so years. I have bipolar disorder. It's been a journey through all of this, learning about your disability and learning about the insurance and how to handle it, and what doctors to go to and who's covered and who isn't, and what medicine, and it's definitely been challenging.
Moving from Florida to Mississippi brought new challenges: fewer providers, longer wait times, a completely different system to navigate.
The medical care here is very different than it is in Florida. Very. Florida, there's just more providers. They're able to get you in a lot faster. It's just been very, very different here.
Jennifer's journey with dual eligibility began in psychiatric hospitals during manic episodes when she had no insurance at all.
I wasn't aware of bipolar disorder or what it can do, and I ended up in a psych hospital more than once because I do things when I'm manic that end up in the psych hospital. And I met people in those programs and in the hospitals that taught me about, Social Security and applying for Social Security.
Her first Social Security application was approved immediately, which is unusual for mental health disabilities. She'd just completed a 2-month stay in the hospital that likely influenced the decision.
To be honest, the first time I ever applied for Social Security, I was approved right away. Which is unheard of. I had just gotten out of a 2-month hospital stay, though, and I think that played heavily on it.
But the system's unpredictability soon revealed itself. Jennifer got a part-time job, working 2 days a week for $12 an hour. That triggered a review that changed everything.
A doctor, a Social Security doctor, decided that I didn't need my disability anymore because I could work 2 days a week. And so then they canceled my disability. They listened to him and not to my own doctors. They listened to their doctor. And then that triggered 5 years it took me working with a lawyer to get back what I lost.
A 5-minute appointment erased 5 years of security.
I saw the guy for 5 minutes, maybe. He asked me some questions like, I see here you're working, and how's that going? And I said, it's going okay. And I guess he took that to, she can work. I didn't know he was making that choice. I didn't know until I got paperwork months later that says, we're canceling your benefits.
Even her own doctor's records couldn't override the 5-minute assessment. Her lawyer was shocked by the decision.
My own doctor sent in all the records, but they went by this guy who met me for 5 minutes. And even my lawyer was shocked that they canceled my benefits. And she works with, disability every single day. And I was young and I was new to all of this. There's no directions, when you get put on disability and Medicare and Medicaid, there's no rule book, or you kind of have to figure it all out on your own.
Now, Jennifer would love to work part-time again, but she's terrified of triggering another review.
I would love to get a part-time job, but I am scared to death to even think about it, because we can't afford to lose the money that I get. And more importantly, the Medicare and Medicaid, that is so huge for me and my disability, because I can't afford to go to doctors and be paying thousands of dollars a month for medications.
We're stuck in it.
Jennifer was diagnosed with bipolar disorder at 21. Mental illness runs in her family, so the diagnosis wasn't surprising, but learning to live with it has been a long journey.
I was, diagnosed as bipolar. I think I was 21. So it's been a long time since I came to grips with everything. It's not been easy, at a young age, even at 42, to be considered disabled. It's not easy.
She's found the right combination of medications and has strong family support. She even told her fiancé about her bipolar disorder on their first date.
My fiancé now, going into our relationship, I let him know, first date. I'm bipolar. My medication has had my bipolar controlled for quite some time. I take the right combo. It took a long time to get here with the right amount of meds.
However, there's one significant barrier to their relationship. They can't legally marry without risking her benefits.
I call him my husband. He's my fiancé. He says, well, I can't marry him because I would lose benefits if I married him. So we call him husband, but he's not.
In Mississippi, love can cost your health care. Marriage equality doesn't exist when benefits are tied to poverty. For Jennifer and her fiancé, the financial risk is just too great.
It's tough not being able to marry the husband, the man that I had my son with. And we could, but then financially it would be just too much of a blow for us. I want my son to know his parents are married. They say that, I was reading about this, and they say kids that their parents are married, they feel more secure. And I want him to feel the most secure as he can.
She's not alone in facing this choice. She knows another woman who was advised to divorce her husband so she could qualify for Medicaid to treat her cancer.
She was married to her husband for a long time, and she got cancer. And they advised her to divorce her husband so that she could get Medicaid, because if not, they could not afford to treat her cancer. And she did. She cried and cried. I can't even imagine. Gets me every time. But yeah, it's tough and it sucks.
Moving from Florida to Mississippi meant navigating an entirely new system and a process that took over 6 months.
As far as Medicare and Medicaid and all that goes, it was a nightmare. I am not gonna lie. It took me over 6 months to get back having Medicaid and Medicare. I had Medicare because that's a, national thing. But Medicaid, I had to wait. I had to get a letter from Florida stating I no longer lived there, and they had to send that letter to Medicaid here, and it took them months and months.
The insurance representative in Mississippi wasn't interested in Jennifer's needs. She was interested in her commission.
The insurance agent came out and asked me what I was looking for, and I told her. And then she went back and sent me a bunch of different options, and none of them were what I asked for. They were I did a little investigation, they were what was gonna pay her the most money for me signing up.
Jennifer had to research and call 9 different plans herself to find appropriate coverage.
There would only be 1 or 2 choices. This 8, 9, 10 different companies that are all offering pretty similar, but not exactly the same. It just makes it more confusing for everybody else. Like, I hate that it's not equal, and it's hard. It's hard for people to figure it out.
When she confronted the representative about prioritizing a commission over client needs, Jennifer advocated for herself.
I advocate for me because nobody else is going to advocate for me, so I need to advocate for me, especially here in Mississippi. But it's ridiculous to me. It shouldn't be this way. It shouldn't.
Just like everybody else.
As a mother, Jennifer thinks about what she'd tell her son if he ever needed these programs.
I just want him to know that, I hope that there is still Medicare and Medicaid and all of that when he is in my age, because I don't know if there will be, and I hope and pray that there is. And if he is in my position, you are loved, and you're capable of being loved, and you're capable of loving. And just be positive. Things will work out.
She wants him to know that disability doesn't diminish worth.
It's not the end of the world either. You can be disabled and have a perfectly normal functioning, life. We're just like everybody else.
That's her message to the world, that disabled people desire what everyone else wants.
We just want the same things that everybody else has, and we want and need medical care, and it shouldn't be something you have to jump through a million different hoops to get. And there should not be a stigma on people that are disabled. I hate that. We are not lazy. We want to work. We want to be productive members of society.
Jennifer's dreams are simple, but feel financially out of reach. Home ownership with some land and travel.
I just want to be the best mom I can to my son. That's my goal, to raise him to be a kind and good human. I would say that's my goal. But one thing I would really like to do, and I'm not able to because, not necessarily because of disability, but just because financially, I would love to travel. I want to go. I want to see the country. I want to see the world. I want to take my son and show him the world. But financially, we're doing all we can to pay our bills.
The two hardest struggles she faces are the marriage penalty and the work disincentive. Both are unnecessary barriers that keep her from full participation in American life.
I think the main thing I wanted to talk about is, not being able to marry my fiancé and the difficulty of that. And again, not that I'm not allowed to work, but do I want a chance working, those are the things I wanted to touch on, because those are probably the two biggest struggles that I'm having currently.
Love and work.
Jennifer's story from Mississippi reveals how dual eligibility creates a parallel system of citizenship, one where love and work become impossible privileges rather than inalienable rights. In a state where approximately 180,000 people navigate dual coverage, her experience exposes the arbitrary nature of disability determination, the complexity of interstate transfers, and the impossible choices the system forces on families. A 5-minute doctor's visit cost her 5 years of benefits and legal fees. Moving states meant 6 months without proper coverage despite having the same medical needs. Wanting to marry her fiancé and the father of her child means risking the health care that keeps her stable. Jennifer manages bipolar disorder successfully with medication and support, but the system treats her stability as evidence she doesn't need help, rather than the proof that the help works. She wants to contribute through part-time work, but she rightly fears triggering another arbitrary review. She wants to marry the man she loves, but they can't afford for her to lose Medicaid coverage. These aren't policy abstractions. They're daily realities that shape every major life decision. Jennifer calls her fiancé her husband, but she knows the legal truth. She dreams of travel and homeownership, yet she is trapped within the narrow financial constraints of benefits designed for survival, not thriving. Her message is simple. Disabled people want what others take for granted. Healthcare shouldn't require jumping through endless hoops. Work should be encouraged, not penalized. Marriage should be about love, not the loss of benefits.
We're just like everybody else.
But in a system that treats disability as a personal failing rather than a fact of human diversity, being just like everybody else remains an aspiration rather than a reality. Jennifer's strength, advocacy, and determination have gotten her this far. Yet individual resilience shouldn't be the price of basic dignity. As she raises her son and hopes these programs will still exist when he's older, her story reminds us that true equality means not having to choose between love and survival, between contribution and care. In Mississippi and across America, hundreds of thousands of people navigate the same impossible choices Jennifer faces daily. Their stories matter, their dreams matter. Their right to full participation in American life, including marriage, work, and the pursuit of happiness, should not be conditioned on their health status or a broken system.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, visit dualcostofcare.com.